indicated drug-seeking behaviors, external prescription drug diversion. Some of the common red flags associated with this would be prescriptions for the same drug, the quantities. We look at the particular diagnosis, same doctor or veterinarian writing those prescriptions, the number of prescriptions that are written, the types of medications that would be essentially written, and how often that patient is being seen. But these are some of the red flags that you would see that would draw some attention to what you're writing. So we want to be cognizant of that, but also the large quantities out of your scope of practice. Just be cognizant of that, not writing prescriptions that are out of your scope of practice. Can you give an example of something that would be out of your scope of practice? I mean, just a real red flag. Anybody got one? So you can write everything you want.
Heart failure drugs.
Heart failure drugs. Well, not necessarily. Well, there are some heart failure drugs that would be a problem, but what is that? Absolutely, palliative care drugs. Okay. So there's some things that would be a little off limits for your practice. So you want to be careful about that. Cash payments, does anybody see a problem with that? Well, let me just say this. In the veterinarian practice, we want cash payments, don't we? Right. I think that really pertains mostly to the human side, private sector. Though there are some insurance plans that are making their way into the veterinarian practice, especially in the large animal side, for some insurance coverage. But if I want to come in and pay $10,000 for medication, that might get somebody's attention. So I'm just saying cash payments or big payments consistently for large quantities of medications would be a problem. Early refills. Watch those patients that do request come in all the time for the early refills or refills that are early for the pets, okay? Diversion logs. That's what I was sort of describing about those that get together and sort of target a particular area, which would be writing a lot of prescriptions for the diversion process. What do you do in case you do come up with a diversion that occurs? As indicated, you want to contact the DEA. Now, there's a form that's called a 106, DEA form 106, that would need to be filled out whether you're a pharmacist or veterinarian practice. It's identifying a significant loss. So it's DEA form 106 is what you want to be able to report. You want to identify the quantity loss or not able to account for, the specific controlled substance, what it is, all those documents that go along with that documentation. But it's pretty self-explanatory, the document itself, but it's 106 DEA form that has to be filled out. Okay. Don't want to have to do that too often, if at all possible. It pretty much sums up, kind of in a nutshell, about this prescription drug monitoring program. Some of the highlights about controlled substances. Are there any sort of questions? I know it's been sort of kind of routine in the sense that a lot of things might be, you want to say a CS, a common sense attitude, but you want to protect your license, okay? You want to do what's right, you want to do what's prudent. That's the main thing, is one of those questions that comes up, did I do what was reasonably considered prudent? Okay, it's kind of the, I guess, the legal jargon that comes up, reasonable improvement. All right, so you must be reasonable improvement in what you're doing in your practice. But main takeaways I like to say is that be able to understand what the prescription drug monitoring program is. Again, you can visit the prescription drug monitoring website. Also, be aware of some of the form, the DEA Form 106 that you have to turn in if there is a loss of controlled substance. Are there any questions about anything that we talked about on that particular subject? Okay. There's one thing that I do want to mention. That have you heard of the MME, a designation about opioids and MME calculation? Okay. And the MME is the actual measurement for the morphine milligram equivalent. It's called MME. And you hear that designation. The CDC has some guidelines associated with prescribers, okay, and the quantities that they can prescribe for their patients. One thing that you do want to remember when you do prescribe your opioids is to sort of indicate on your prescription what it is being used for and the number of days that it will be used. Okay. If you have an acute condition for your patient, acute pain, how many days would you consider reasonable for an acute pain situation to be treated for? How many days? 3 to 5, no more than 7, but certainly not for 6 or 7 months for an acute pain, right? Okay. You want to indicate somewhere on that prescription to help out whether it's for an acute condition. If it's for a chronic condition, what would be considered some chronic conditions that you may be treating a pet for, as far as pain management? Arthritis. What else? Cancer. Anything else you can think of that would be a chronic type situation? Okay. What is one of the most highly prescribed medications in veterinary practice? For pain management, excuse me. Pain management. I heard tramadol. What else? NSAIDs. Okay. The same things that are pretty much prescribed out on the human side for the animal side is the same as far as pain management, chronic conditions, debilitating conditions. Now, you want to make sure that you do document acute or chronic, okay? If, for example, you don't fill that prescription at your site, you write that prescription to go out to the private sector, and you ask or it goes to a private sector pharmacy to be filled. One of the things that's going to come up is just what I just said, the focus on whether it's an acute condition or chronic condition for pain management, okay? So that must be somewhere sort of documented there, because there will be a question of how many tablets the patient would be getting, even though it's for the pet, how long this treatment program is going to be going on, okay? So you want to make sure that you're aware of that, because some pharmacies, by their policies and procedures now, will cut down on the number of tablets that that particular client would be receiving, okay? Especially if it's for an acute condition. So if they're getting an acute condition and they're getting 180 tramadol, could be a big dog, don't get me wrong, but 180, and they have an acute condition, then maybe they don't need 180, okay? So we want to watch that, all right. On Schedule 2 drugs, how many refills can you get? 0, exactly. Schedule 2s, so I have no refills. A new prescription must be written each time. What category is tramadol in? Schedule 4. But tramadol still is an opioid, even though it can be written with opioid, and because of that, and the morphine milligram milliequivalents, it is captured in the system. Okay. So I do want to hone in on that for a particular reason that you should, chronic or acute conditions. Okay. All right. Question.
So my mom is a pharmacist, and she's been telling me that it's all changing because of the drug use.
Yes, sir. It is.
Now it's going to be like you will have to write prescription this time.
Yeah. Matter of fact, in certain, well, I'll just state of Alabama, Walmart, for example. Walmart is one of the kind of out in front on this problem situation, in that they are turning prescriptions, let me just characterize this properly, acute and chronic. Acute conditions, according to the CDC guidelines, only going to be covered for a certain number of days. Anything beyond that, they have the right, by policy, to not fill the additional amount, okay? And that would be lost as far as being able to be filled again. It would require another prescription to come in. With the hydrocodone product, again, acute or chronic condition, if it is not, well, if it's designated or prefers filled. Now, somebody could say, I have acute condition, but I have this acute condition every month. Okay, prescription drug monitoring program. You're going to be monitoring some sort of way, and you have an acute condition every month. Red flag, red flag, red flag. Okay. Now you keep writing that prescription for that acute condition every month as a prescriber, veterinarian. Red flag, red flag, red flag. Okay, when is this acute condition going to become a chronic condition, or when is this patient going to finally be well? So those things that must be looked at and will be looked at if it is going into that database on persistent patients. Okay. Appreciate the question.
Yeah, he works for Walmart.
Oh, okay. Well, that's the one. That's the one. What?
Do you still have the sign-in sheet?
I'm sorry.
Do you still have the sign-in sheet?
Yes, I do.
Okay.
Still here. Do you need to sign in?
Yes, I need to make sure I signed in. Thank you.
I have a question.
Sure.
So in our case, as veterinarians, for instance, let's just say a patient comes in with a back problem, or we're paying for surgery, so therefore you're gonna put this animal on long-term pain meds. How does that work?
No, that's fine. Okay. The thing about it is that you, let's put this in perspective in real life. Document, document, document. That is the saving grace for you. Okay? Saving grace for the pharmacists that fill your prescription. Document, document, document. So, we're going to do due diligence. You've got your notes and everything about the condition. No one's questioning your veterinarian diagnostic assessment. That's not what this is all about. Document what you're doing, indicate that. And that's a good point about surgery and just treatment, maintaining the quality of life for the patient. All those kind of things are very important. So that could be the case. And not trying to deny pain-free type opportunity for the patient's quality of life for the owner as well that has that pet. So just want you to use reasonable and prudent judgment as about the quantities. Hey, gee, I'm going on this trip. I'm going to need at least 6 months worth of pain medication. I don't think so. Okay, we better not do that. So you want to be cautious. That's real. Summertime vacation. I need 3 months worth of this medication to go. Don't think so. We can't do that. Okay. So not preventing treatment, but we're going to have to come back and get a prescription filled and work something out where this could be managed a little bit differently. Okay. Yes, sir.
So I know, like most of the vet clinics have already the drugs, like
Yeah.
shelf. Do we know, or is this a place that we can actually search for the type of meds that we have to prescribe and look for them out?
Yeah. Now, the formulary is one of the names that you may be describing for a practice site or formulary. We we do have in our database, Cornerstone is what we use here. You can go in and look and see what medications are there. Now, we don't have it where you can just print out a whole list of the database. The reason-
My reasoning is, if we send someone to Walmart, they don't have the certain like concentration on a dog.
That's true, that's true, that's true, that's true.
How do I know if we send them or if I just wait?
Well, what we're gonna do is that, if you're not connected by their e-script program or electronically, we're gonna have to pick up the phone and call and ask. That's probably the old-fashioned way, but you do have to call and ask, especially in your practice as a veterinarian. Some of the private sector pharmacies may not have what you need, okay, or that patient's gonna need. So you do wanna try to save that time for your patient, finding what they need. And probably want to establish some sort of rapport with their practice, pharmacy practices in your area too. To kind of see what they do have, some of the things that you're going to commonly need to treat your patients that come in. You may have a dermatology practice, for example, a specialty. Then you're going to need to be in contact with someone out there, or have them in-house if possible, so you can recoup that profit margin. But if not, you're going to need to seek some particular pharmacy somewhere or some relationship for your patient so that they won't be scrambling to try to find out where these things are. But that's a good question and a very valid point about knowing what's available to treat your patients with. That's good. Okay? Any other questions? I like the questions. Anything else? Okay. All right. I'm going to shift gears just a little bit and let's see. Okay. This particular part of the presentation will be about over-the-counter meds and pets. A lot of this information I was able to peruse from one of your veterinarians in practice, Dr. Lomelina, and through a presentation that I was able to attend. And this is going to cover some of the over-the-counter medicine that are used for pets. Okay? Some of them I think you'll be familiar with, kind of a review I hope, but we'll kind of put it into the perspective of, like you said, when a patient of yours goes to a pharmacy site for trying to treat or self-treat, because many times the owners of the pets may not have come to you first. They may try to self-treat or treat and go to somewhere to seek some support. This will kind of identify some of those things that are out there that are over the counter, found in many pharmacies, that would help to treat some of the pets that are out there. We're going to, I hope that's not too small, but anyway, we're going to review some of the kind of the learning objectives here, but we're going to hope that you'll be familiar with students with over-the-counter medications, supplements, and products that pet owners may seek counsel for use, and You'll be able to discuss these conditions that they're indicated and their precautions. Objectives will be to identify common medications used for pets that are available over the counter. Review indications associated with common OTC medications and supplements. Review drug doses and toxicity with commonly used OTC medications and supplements. And describe key counseling points that you would use or that could be used to address some of these inquiries, okay? Now, these particular products would be things that would be available to your patient's owners, okay, to the pet owners. And they can be a lot of times purchased without a prescription. But these are things that if they don't know enough about, that they would ask questions. Many times as a pharmacist out there, as a veterinarian, you have seen this patient, and then they come out there to the private sector to seek help to try to treat their pet. These are some of the questions that possibly would come up. And sometimes they'll self-diagnose the conditions and can get in trouble about what they're picking up that's over the counter to treat the pet with. So we want them to be safe in that making those choices. Okay. Frequently asked questions from pharmacists to veterinarians. A lot of times we'll want to know if we have a relationship with you as a veterinarian. There are a lot of questions that these clients will come in with, okay?